Hello everyone and welcome back to our channel. Today we're diving into a topic that touches all of our lives, especially as we get a bit older and wiser. Health insurance. I know. Just hearing those two words can make your head spin. It feels like a maze of confusing terms and endless paperwork. But what if I told you that with just a few key questions, you could navigate it with confidence and peace of mind? Stick around, because by the end of this video you'll feel empowered to make the best choice for yourself and your loved ones. I remember sitting with my own parents, sifting through stacks of brochures. Their faces were a mix of confusion and worry. They'd worked hard their whole lives, and now when they needed security the most, they felt lost. It was that moment that made me realize how crucial it is to simplify this process. This isn't just about policies, it's about our health, our future, and our family's well-being. So let's walk through this together, step by step. Our first essential question is, what does this plan actually cover? It sounds basic, right? But the devil is in the details. You need to look beyond the big-ticket items like hospital stays. Ask specifically about preventative care. Does it cover annual checkups, screenings like mammograms or colonoscopies, and vaccinations? These are the things that keep you healthy and can catch problems early. Also, think about your specific needs. Do you need vision or dental coverage? What about physical therapy, mental health services, or chiropractic care? Don't assume anything is included. Get a list, a document called the Summary of Benefits and Coverage, and review it carefully. Think of it as the blueprint for your healthcare. Next up, question number 2, and it's a big one. Are my doctors and preferred hospitals in the network? This is absolutely critical. You've likely spent years building relationships with doctors you trust. The last thing you want is to be forced to switch because your new plan doesn't cover them. An in-network provider has an agreement with your insurance company to charge lower rates. Going out of network can mean you pay significantly more out of pocket, or in some cases the entire bill. Before you sign anything, use the insurance company's online provider directory to search for your current doctors, specialists, and the local hospitals you'd want to use in an emergency. If you can, call the doctor's office directly to confirm they accept the specific plan you're considering. A quick phone call now can save you a massive headache and a lot of money later. All right, let's move on to our third question, which deals with the real costs. What will my out-of-pocket expenses look like? It's not just about the monthly premium. You need to understand 4 key terms: deductible, co-payment, co-insurance, and out-of-pocket maximum. Let's break it down simply. Your poor deductible is the amount you have to pay for covered services before your insurance starts to pay. Think of it as your entry fee for the year. So co-payment, or copay, is a fixed amount you pay for a specific service like $30 for a doctor's visit. Co-insurance is a percentage you pay after you've met your deductible. For example, your plan might pay 80% and you pay the remaining 20%. Finally, the CU's out-of-pocket maximum GISA is the absolute most you will have to pay for covered services in a year. Once you hit this limit, the insurance company pays 100%. Understanding these numbers helps you budget and avoid surprise bills. A plan with a low monthly premium might have a very high deductible, so it's important to find the right balance for your financial situation. Now for our fourth question, which is especially important if you have ongoing health needs. How does the plan cover prescription drugs? For many of us, regular medications are a non-negotiable part of staying healthy. You need to look at the plan's formulary, which is just a fancy word for its list of covered drugs. These lists are often tiered. Tier 1 drugs are typically generic and have the lowest copay. Higher tiers include more expensive brand-name drugs and come with higher costs. Check if your specific medications are on the formulary and what tier they fall into. If a drug you need isn't covered, find out what the process is for getting an exception. Don't get caught off guard at the pharmacy counter. This is a crucial piece of the puzzle for managing your health and your budget effectively. And that brings us to our fifth and final essential question. What happens if I need care while traveling? Life doesn't stop at our city limits. Whether you're visiting family across the country or finally taking that dream vacation, you need to know you're protected. Some plans, like HMOs, might only cover emergencies when you're outside your service area. Others, like PPOs, often offer a broader network and some coverage for out-of-network care, which can be useful when you're away from home. Ask specifically about coverage for urgent care versus true emergencies. What if you get sick on a cruise or while traveling abroad? Does the plan offer any coverage for international travel? Knowing the answer to this gives you the freedom to live your life fully, without the fear of a medical issue turning into a financial catastrophe far from home. To make this all a little more real, I spoke with Sarah, a 68-year-old retired teacher. When she was choosing her plan, she focused only on the low monthly premium. She didn't check if her long-time cardiologist was in-network. A few months later, she had a heart scare and rushed to her trusted doctor, only to receive a bill for thousands of dollars because he was out of network. Her story is a powerful reminder of why asking these questions is so important. It's not just an exercise. It's a vital step in protecting your health and your savings. After that experience, Sarah sat down, asked all 5 of these questions, and found a plan that truly fit her needs. She says she now sleeps better at night, and that peace of mind is priceless. So let's quickly recap the 5 essential questions. 1. What does the plan actually cover, especially for preventive care? 2. Are my trusted doctors and hospitals in the network? 3. What will my total out-of-pocket costs be, including the deductible and co-pays? 4. How does the plan cover my specific prescription drugs? And 5. What happens if I need care while I'm traveling? Choosing a health insurance plan is one of the most important decisions you'll make. It can feel overwhelming, but you don't have to do it alone. Take your time. Write down these questions and don't be afraid to call the insurance companies or speak with a licensed insurance agent to get the answers you need. You are your own best advocate. By being prepared and informed, you can turn a process that feels confusing and stressful into one of empowerment and security. You've earned the right to have excellent care and the peace of mind that comes with it. Thank you so much for spending this time with me today. I truly hope this has helped demystify the world of health insurance for you. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more content designed to help you live your best, healthiest life. And if you have a question or a story to share, please leave it in the comments below. We love hearing from you. Until next time, take care and be well.